As we age, the rules begin to change from the foods that we eat to the medications that we take to the way that we move and exercise. All the things that once were probably really beneficial for us may need to be tweaked as we age for a variety of reasons. On today's episode, to talk about some of this and separate fact from myth and fiction and give you all the right information to help you age gracefully and very healthily. On today's episode of Ask the Doc, no reservation needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
To Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions, and our medical experts will answer them. I'm Dr. Kamaljit Kaur, a primary care physician here in beautiful South Florida. Let's get started. And our first question today comes from Ernesto, who has reached out to us through allhealthtv.com, our website. Thank you for sending in your question, Ernesto. He asks, "Hey, Dr. K, my pops, Sandro, played professional soccer his whole life, and now that he's retired, I notice he's been popping a lot of over-the-counter pain relievers. Lately, stuff like aspirin and NSAIDs. Is it true that they can raise blood pressure or affect kidneys in older adults?" Yes, Ernesto, this is a great question. And also, I'm so glad that your dad has someone looking out for him like you. And to answer your question, you're absolutely correct. I really appreciate that you are keen to one of the most common issues that we see with our elderly patients and elderly loved ones. And one of the most common causes of them having certain diseases and complications to their health, which is side effects of medications. This is often really underlooked and ignored. And you really hit the nail on the head with this question. It's true. Medications from the class of a family of medications known as NSAIDs, non-steroidal anti-inflammatory drugs, or more commonly known ibuprofen, Motrin, Aleve, Celebrex. There's indomethacin also, which is a prescription, but majority of these are available over the counter, and unfortunately, they can have side effects. And one of those side effects could be negative impact to your cardiovascular health. Through a variety of different medications, mechanisms, these medications can cause your blood pressure to go up. They can cause irritation to your cardiovascular system, so your heart, your arteries, your veins, and other parts of the body, but certainly blood pressure is one of them. Now, although when it comes to medications and over-the-counter ones that we can get easily, the side effects are listed on the bottle. Some of us are more susceptible to those side effects, especially the older that we get, just because parts of our body and certain parts of our organ systems are not as strong as they used to be, so they're more easily impacted and more easily affected. Now, to the other part of your question, aspirin. While aspirin is not particularly known to have an effect on blood pressure in the sense that you're asking, it can have other irritating effects. And some of this is damage to the lining of your stomach. It can also result in something called gastritis, which is inflammation of the lining of the stomach. And honestly, it can even lead to gastric or stomach ulcers. And that's something that I know not a lot of us are aware of, because there used to be a time when aspirin was regularly recommended, especially when you got older, to help prevent things like heart attacks and strokes. So I know it would be hard to believe that such a medication that was so regularly recommended could have such serious side effects in some individuals. So it's very important to be vigilant about what health conditions the person already has, what other medications they're on, and is this something that's really needed for them? Because the number one thing that we like to ensure with our elderly patients is that they are on the medications that they need to be on and nothing extra. Because as you know, sometimes taking too much of a good thing can also be a bad thing. Another thing that I wanted to point out, and this is maybe a little bit more important even is what is going on with your dad that he's needing all these medications. Whenever somebody has a symptom, so whether it's pain or a runny nose or a headache or dizziness, no matter how small or big that you think that might be, any symptom that's persistent and is causing someone to take pain relievers or other over-the-counter medications regularly, then that really requires further investigation to figure out what is the root cause here, because we always want to treat a problem at its root cause. Medications like Aleve, aspirin, Motrin, ibuprofen, they can be great for a limited time, but they are meant to be bandage medications. They're not really treating the root cause problem. And that's what we want to do to make sure that, we're treating the body in the best way possible. And so the person can continue being healthy and who knows, maybe even going back to soccer one day. I hope you get all this figured out, and I hope your dad is back to fighting stance soon. All right, let's get to our next question. And this one comes to us from Mitzi, who reached out through YouTube. Mitzi asks, "Hi, Dr. Kaur. My naturopathic cousin Shelly is a big proponent of St. John's wort and other supplements. We're both in our 60s, and I'd like to know if it's okay to take something like this with prescription drugs like antidepressants and blood thinners." Hi, Shelly. This is such an important question. And again, just like potential side effects, I think this one is underrated as well. And a lot of times not really talked about. Supplements. Now, I'm going to go out on a limb here and give a disclaimer before I get into answering your question. I'm a scientist at heart, and I practice medicine on that basis. I look to our major medical societies and data from research to form the best possible treatment plan for my patients, individualized to them, of course. But I am quite disappointed in the fact that we just don't have enough data in the medical societies to really put our full weight and recommendations and hang our hat on every supplement for everybody. And there are therapies that have been proven in some studies, and there is some potential of some supplements for keeping us healthy, but we just don't know enough about it to really validate that. Now, part of this is there's just not enough studies out there. So they're being done, and hopefully one day we'll get some better answers. But for now, we're kind of in the middle on a lot of this stuff. That being said, while some supplements are largely harmless, and honestly, you'll probably just not absorb them in your body, and they'll probably just flow right through you without causing any harm. There are a few supplements that can actually be dangerous if not taken appropriately or if taken too much of. And then these can cause disease instead of trying to heal it, which I know that's why a majority of us take supplements, is either to prevent disease or try to heal it naturally. Now, St. John's wort is one of those supplements. Even though St. John's wort is thought to help with depression, it shouldn't be used along with prescription antidepressants, especially the class known as SSNRIs. So like Prozac, Lexapro, Celexa, these are medications that the way they work in the body and the way that they help treat depression is by increasing a neurotransmitter hormone known as serotonin. Serotonin is known as the happy hormone or the feel-good hormone, kind of like dopamine. Now, St. John's wort works in a similar fashion to increase levels of serotonin through different pathways, but the end goal for both of them is pretty much the same. And since you're taking one medication that's already increasing serotonin, and then you take another supplement or even another prescription, it doesn't matter. Any secondary medication that has the same effect is really going to boost your serotonin. And while you may think that that's something that's really good because, hey, it's a feel-good hormone, wouldn't I want more of it? This can actually be quite dangerous because too much serotonin in your system can actually have very detrimental effects, and it can lead to a life-threatening condition known as serotonin syndrome. If that happens, the person who's experiencing this will feel a variety of symptoms like really, really anxious mood, a lot of agitation and irritation for no reason, sometimes even profuse and unexplained sweating, racing heartbeat that just won't calm down, maybe even fever because there is some temperature dysregulation that happens with this. So you might have a fever that just won't go down. Uncontrollable shaking or seizures can result also. So as you can see with these symptoms, especially if you have a combination of them, that's a lot on your body, and that can actually be a very, very dangerous situation situation, and that's something we want to avoid. So anytime we prescribe certain antidepressants to our patients, we do tell them that, hey, there's a chance that this might happen, so please don't take any extra supplements with this. And if you do want to take a supplement, then of course, always talk to your doctor about it. So as you can see, it's really, really important. Now with St. John's wort, it can also interact with other medications, such as blood thinners. And warfarin is a very common blood thinner that a lot of our patients are on. And in fact, I had a patient of mine several months ago who's been on warfarin for a very long time. And she wrote me a message and she emailed to ask me, hey, Dr. Kaur, I wanted to start taking St. John's wort. Is that safe for me? And firstly, I was so proud of her for asking me, because when you're on medications, you always want to ask your doctor before you take anything, because we want to make sure it's safe for you, right? So I educated her a little bit and I said, unfortunately, St. John's wort isn't the best thing for you to take. In fact, I advised her to avoid it altogether. And that's because St. John's wort can actually reduce the effect of warfarin. Now, majority of people who are on blood thinners like warfarin are on them so it keeps their blood thin and prevents the formation of clots, either in the brain, in the lungs, or in any part of the body. And if the warfarin is not working the way that it should, and it's not keeping the blood thin, then that can actually predispose them to and increase the risk of them having a major clot. And that can, as we all know, be very life-threatening. So you don't want to take a medication that's going to reduce the effect of warfarin, like St. John's wort. So you want to avoid that also. Now, just like with St. John's wort, there are so many other potential interactions and side effects that are possible when you take supplements. So again, I'm going to say it a lot, but I really want to emphasize it. Always talk to your doctor before taking any supplements to make sure they're not interacting with your medications. And if you're not on any medications, but you feel like, hey, I want to start a new supplement regimen, still talk to your doctor, because you never know. For your particular situation, some may be better than others and some may be harmful. So we never want anything to risk and cause any kind of harm to your health. All right, let's get to our next question. And this one comes from our YouTube. So one of our YouTube viewers sent this in. Thank you. And this one comes from Subhash, who asks, greetings, Dr. Kaur. My wife of 40 years, Radha, and I enjoy an occasional glass of coffee with dinner. It's a traditional fermented drink from southern India that contains alcohol. Our daughter, who's pre-med, recently told us that people with heart conditions should never mix alcohol with prescription medications. Is she right? Hi, Subhash. I'm so glad that you sent in this question, because it's a very, very pertinent one, and one that I get asked a lot. And kudos to your your daughter, future doctor, for applying her textbook work. Because, one of the biggest things and the biggest challenges a lot of people have with medical school and medical training is not being able to apply what they learn in the books to real life situations. So I'm glad to see that she's already getting started. And she's absolutely correct. Alcoholic drinks can significantly change the effects, the safety, and the metabolism of a lot of prescription and even non-prescription medications. So you're taking a medication for a certain reason, but if you take it with alcohol, or if you take a drink of alcohol near the time that you took the medication, that can completely change what that medication does for you in your body, and it may go from being helpful to being harmful. We don't want that to happen. So your risk of adverse events and the toxicity of that medication definitely increases with alcohol. Now, it also depends on what medication it's taken with, of course. For instance, something as simple as acetaminophen, Tylenol. A lot of us think because a medication is available over the counter, it's mostly harmless. Not true all the time, and definitely not true if you're going to mix it with alcohol. When you mix acetaminophen with alcohol, it can actually increase the risk of respiratory depression and liver toxicity. Now, acetaminophen is metabolized through the liver. So sometimes we might see a person who's taking a lot of acetaminophen for whatever reason, taking it on a regular or daily basis, can have a little liver damage, and usually that's reversible once you stop the medication. But if you're taking it with alcohol, this definitely increases the risk of that. So you want to avoid that at all costs. Now, when it comes to your cardiovascular health, taking certain medications along with alcohol can also result in potentially detrimental effects. So you can have a reduction in blood pressure. You can also pass out, because if we think about it, alcohol is a nervous system and respiratory system depressant. Now, a lot of blood pressure medications kind of work in the same way, and that's a very generalized statement, but some of them do. And if you have, two things that are reducing your cardiovascular function, your respiratory function, and your neurological function, nervous system function, that's going to put you in a very, very, very bad place. Sometimes you can even get dizzy if you're taking a blood pressure medication and you're taking alcohol along with it for similar reasons. And then, of course, this can all be very, very life-threatening. And then one thing that we also, I think a lot of people don't know or we forget to mention is your heart rate. Now, when your heart beats, it beats at a very regular rate. It's supposed to be lub dub, lub dub, loved up. So very boom, 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 very, very regular. But if you take certain medications that are meant to improve your cardiovascular health along with alcohol, that can actually result in an irregular heartbeat. And sometimes that can go on, and that is certainly a cause for concern and can be life-threatening. So as you can see, there's a lot of potential for harm. While it may be okay to enjoy a glass of coffee now and again, do avoid doing it with any prescription medications. Avoid alcohol when you're sick or you're just not feeling well. And like I always tell my patients, once in a while of anything is okay, but when it comes to alcohol, we certainly want to minimize and try to avoid it altogether, because at the end of the day, it is something that even if it's just minor, it does harm our bodies. Now, in case you missed it the first time, here's how you can send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, moving on. Our next question comes from Tori, and she emailed us this question via questions@allhealthtv.com. And let's see, Tori asks, "Hi, Dr. Kaur. My mother is in her early 70s, and I'd like to know what are the most important vaccines for older adults, and why do some need boosters even if they had them years ago?" Hi, Tori. Great question, and something that's very, very pertinent. But before I share my thoughts, let's take a look at this video from our friends at the Mayo Clinic.
Aging is inevitable, and parts of the process can be unpleasant.
As you get older, your immune system gets weaker. That's why we see more severe infections in older people.
Dr. Gregory Poland, who heads up the Mayo Clinic Vaccine Research Group, says it's why vaccines become especially important as you get older. And it's why his team at Mayo Clinic looks for ways to tailor vaccines to better protect older people.
There are 3 influenza vaccines, 1 shingles vaccine, and 1 hepatitis B vaccine that have been designed around those issues and that work better than the standard vaccines in older people.
He says it's important to note that these vaccines aren't perfect and won't always prevent you from getting an illness, but they do protect you from complications from illnesses like the flu.
So you might have had sniffles or fever, you were home for a day or 2 from work, but you didn't get hospitalized, you didn't get pneumonia, and you didn't die.
For the Mayo Clinic News Network, I'm Ian Roth.
So while we should all be vigilant about preventing disease, and a lot of us want to, it's one of the most common questions I get from people in my practice of all ages is how can we stay healthy and how can we not get sick, because I want to live long and I want to be strong. Well, we often forget one of the most powerful weapons that we have in this fight, and that's vaccines. And vaccines become even more important when your immune system is at a weakened state. So for instance, babies in their first couple years, they have a very weakened immune system for obvious reasons. They're new, they're growing, things are still developing. So we want to encourage, vaccinations to really help that immune system stay strong and prevent disease. You can apply that theory similarly to the elderly. And I say elderly, but elderly it's a relevant term. In the old days, we used to think 60 was elderly, but I mean, if you see some of my 60-year-old patients, I hope I'm half as healthy and strong as they are when I'm that age. So that is a relevant term, but we do want certain age groups to know that they might be at an increased risk. For instance, after age 50, we start talking about the shingles vaccine. After age 65, we start talking about the pneumonia vaccine. After age 60, now we're talking about the RSV vaccine. And, this becomes important especially as we age. Why? Because our immune system does tend to get weakened for a variety of reasons. We're just not as strong as we used to be, unfortunately. But that doesn't mean that we're going to get sick for sure. There's ways that we can strengthen our immune system naturally. So eating healthy, exercising regularly, getting good sleep, avoiding stress if you can, and really having a good social connection with our loved ones. Those are all ways to stay healthy naturally as we age. And then on top of it, if you want to up the ante on that, on prevention, introduce vaccines into that regimen. Now, when it comes to vaccines, as you mentioned, some of them do require boosters. And this may be something like, hey, I already got so-and-so vaccine. Why do I need a booster for it? And that's because studies have shown that certain vaccines, for instance, the tetanus vaccine, a lot of people forget about the tetanus vaccine. We get it when we're young, we get it throughout school. And then as an adult, it's recommended to get a booster once every 10 years. But I can probably name off a handful of my patients who ever even remember to do that. So it's common to forget it. But we've seen that the immunity that's induced by those initial series of tetanus vaccines do tend to wane and go down as we age naturally. So that's why that booster is recommended in order to get that up to its optimal stance in your body, so it can really help prevent that infection. Now, when we talk about vaccines, there's a variety of them, and not every vaccine is suitable for everybody. So there are general recommendations, but you always want to talk to your doctor and see what's right for your health. For instance, the pneumococcal or the pneumonia vaccine, previously this was recommended for patients age 65 and older, regardless of their health status. And now, in fact, major medical societies are recommending it at age 50, or to start considering it at age 50, because we're seeing a higher incidence of that disease. Now, those two things being said, it's also important to note that there's a group of individuals who are considered to be high risk for contracting pneumonia, and they're recommended to get the pneumococcal vaccine at any age. For instance, individuals with asthma, even if it's well controlled, individuals with diabetes, even if it's well controlled, certain cancers, certain people with cochlear implants, for instance. So there's a whole list of a high risk group, as they call it, that should get the pneumococcal vaccine regardless of age. And again, that's due to the fact that they have a slightly weakened immune system due to their chronic conditions, just as we see a slightly reduced immune system as we age. I always like to equate it to a car. Now, I don't know if anybody keeps a car for more than 10, 15 years anymore, but if you do, which is great, I think, you think about it, you want to keep that car going for as long as you can, right? So you got to do regular checkups, you got to do oil changes, you got to get new tires every so often. All of that hopefully is preventative, and you don't do it because something broke down. So vaccines, you can kind of think of it in a similar way. You want to keep your car, which essentially your body is a car because it's a sort of mechanical machine that keeps going. You want to keep it healthy, and that's one of the best things that you can do is vaccinations. Now, there are times when vaccinations actually aren't the best for every individual. So again, you want to talk to your doctor or your pharmacist and make sure that you're doing what is healthy for you and tailored to you, because not every recommendation is meant for everybody. All right, let's get to our next question. Oh, and this one comes to us from Facebook, and it's from Cece. And Cece asks, Dr. Kaur, I'm not sure where I heard this, but is it true that vitamin B12 is good for nerve issues such as nerve compression? Hi, Cece. Thank you for sending this in. It's a great question. And yes, vitamin B12 does play a huge and very important role in keeping our nerves healthy. It helps maintain the protective covering or coating that surrounds our nerves. And that coating is not only important in protecting the nerve, but also for nerve conduction. And when that coating is affected in any way, then obviously that nerve conduction is impacted, and you might feel numbness or tingling or muscle weakness or symptoms like that. Now, if somebody has vitamin B12 deficiency and is not able to supply their nerves with that healthy supplement, then this affected person will feel the impact of that. And, they can even have chronic pain, especially if it's a compressed nerve. Now, correcting that vitamin B12 deficiency will certainly help, and it will certainly improve some of the symptoms. But if the symptoms are due to a compressed nerve, then really the treatment of choice is going to be to figure out what it is that's compressing that nerve. Is it a surrounding muscle? Is it a surrounding bone? Is it something else that's going on with another organ? Because fixing that is really going to be what's going to fix that nerve compression. And of course, the vitamin B12 is going to help, and it's going to help that nerve heal and regenerate, hopefully, but it's not going to be the entire treatment. And, to really figure it out, you're probably going to have to see your PCP for sure, but also maybe a neurologist or an orthopedic surgeon to get some testing done and to really pinpoint what is the cause of your symptoms and that nerve compression. And then that's what you're going to want to treat. Just like I said earlier, supplements are great. And in fact, a lot of supplements are innately found in our body and are really essential for our day-to-day workings and to optimize the mechanisms in our body. But not all of them are 100% necessary. So you always want to talk to your doctor about what's best for you. When it comes to vitamin B12, if you have a deficiency, there's several ways of treating it. It could be treated with tablets, it could be treated with injections, and it could be treated with sublingual or under the tongue type of medications as well. I hope that helps answer your question. Well, I've had a great time going through these questions, and I really appreciate you guys sending them in. Keep on sending them in, and we'll keep answering them. I'll see you next time here on Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.